Now let us move to the popliteal fossa. This is the popliteal fossa. It is diamond in shape. Its upper lateral boundary is formed by the tendon of the biceps femoris, while its upper medial boundary is formed by the tendon of the semimembranosus, and the adductor magnus muscles. The lower lateral boundary is formed by the lateral head of the gastrocnemius and the belly of the plantaris muscles. The plantaris muscle is absent in this body, but when present, it lies just medial to the lateral head of the gastrocnemius. The lateral head of the gastrocnemius is crossed by the common peroneal nerve. The lower medial boundary of the popliteal fossa is formed by the medial head of the gastrocnemius muscle. The fossa is roofed by deep fascia and is pierced by the short saphenous vein. The floor of the fossa is formed by the popliteal surface of the femur, back of the knee joint, and the popliteus muscle. The main contents of the fossa are the popliteal vessels and the two divisions of the sciatic nerve, namely the tibial and the common peroneal nerves and their branches. This is the popliteal artery as it appears from the opening in the adductor magnus as the continuation of the femoral artery. It runs in direct contact with the floor of the fossa as the deepest structure. It runs downwards from the upper medial boundary of the fossa towards the midline of the fossa. It gives off the superior lateral genicular branch, which runs laterally above the lateral condyle of the femur, and the superior medial genicular, which runs medially above the medial condyle of the femur. At the midline of the fossa, the popliteal artery is covered by the popliteal vein and the tibial nerve. This is the cut end of the popliteal vein. This is the tibial nerve, and it runs exactly vertically in the midline, superficial to both the artery and the vein. The tibial nerve gives muscular branches to the muscles while in the popliteal fossa. This is the branch to the medial head of gastrocnemius. This is the branch to the lateral head. This is the branch to the soleus. This is the branch to the popliteus. The nerve to the popliteus runs over the superficial surface of the muscle to wind around its lower border to gain its deep surface. These are the inferior medial genicular vessels. passing below the medial tibial condyle, and these are the inferior lateral genicular vessels passing below the lateral tibial condyle. These are the middle genicular vessels facing the back of the capsule of the knee joint. Note that the common peroneal nerve does not give any muscular branches while passing through the popliteal fossa. The tibial nerve gives off only one cutaneous branch while passing through the popliteal fossa. It is the sural nerve. This is the sural nerve. It descends beneath the deep fascia of the leg between the two bellies of the gastrocnemius muscle, in company with the short saphenous vein. It is joined by a sural communicating nerve, which arises from the common peroneal. This is the common peroneal nerve. It runs in the lateral part of the popliteal fossa and gives off two cutaneous branches while in the fossa. These are the lateral cutaneous nerve of the calf, which supplies the skin of the calf, and the sural communicating nerve, which joins the sural nerve. The common peroneal crosses the back of the head of the fibula and the lateral side of the neck of the fibula, where it divides into two main divisions: the deep peroneal and superficial peroneal. This is the superficial peroneal nerve, which runs downwards in the lateral compartment of the leg and supplies only the peroneus longus and brevis. This is the deep peroneal nerve. It enters the anterior compartment of the leg to supply all the extensor group of muscles. Note that the common peroneal nerve is exposed to injury in fracture of the neck of the fibula.